In a previous video, we discussed Cluster B, the second cluster of personality disorders, which consisted of antisocial, borderline, histrionic, and narcissistic conditions. In this video, Cluster C of personality disorders will be discussed, which includes avoidant, dependent, and obsessive-compulsive personality disorders. Let's dive deeper into what these disorders entail rather than just looking at the surface level details. First, we have avoidant personality disorders. More than just being shy or awkward, AVPD is characterized by feelings of extreme social inhibition, inadequacy, and sensitivity to negative criticism or rejection. In social situations, a person with AVPD could be afraid to speak up, fearing saying the wrong thing, blushing, or displaying embarrassment. People who have the disorder may display behavioral symptoms like avoiding work, school, or social activities to avoid criticism or rejection, low self-esteem, and self-isolation. Psychotherapy is the main treatment for those with AVPD. Psychotherapy is individual counseling that focuses on cognitive and behavioral therapy, helping an individual overcome fears, change behaviors, and better cope with social situations. Antidepressants or anti-anxiety medication might be used to help manage anxiety felt in social situations, and it is best combined with psychotherapy. If you know someone who has AVPD, there are a couple ways to help out. Firstly, setting and enforcing personal boundaries, making sure that it is clear what you can and cannot deal with are both helpful. Encouraging the individual to develop their support network is incredibly important as well. It is also important to not take their behavior personally, remembering that their behavior is a reflection of their disorder and not you. The next type of personality disorders we will discuss are dependent personality disorders, or DPDs. People with DPD have an overwhelming need to have others take care of them. Often, a person with DPD relies on people close to them for their emotional or physical needs. Others may describe them as very excessively needy or clingy. They may have the belief that they are unable to care for themselves, having trouble with everyday decisions without reassurance. Symptoms of DPD may include trouble making everyday decisions, avoidance of personal responsibility, difficulty being alone, fear of abandonment, and a sense of helplessness when relationships end. This also includes oversensitivity to criticism, pessimism, and a lack of self-confidence. DPD can be managed with the help of a mental health provider utilizing cognitive behavioral therapy. Depression medication or sedatives may be prescribed if the disorder is causing depression or anxiety. Things that can help a person with DPD include practicing self-sufficiency and assertiveness, learning to cope with fears of being alone, practicing making decisions, becoming comfortable spending time on their own, and learning how to express disagreement in productive ways. Lastly, we will be discussing Obsessive-Compulsive Personality Disorder, or Ocpd. This disorder is characterized by a pervasive preoccupation with orderliness, perfectionism, and control, with no room for flexibility, that ultimately slows or interferes with completing normal tasks diagnosed by clinical criteria. Because it can be hard for a person with OCD to see their issues, it is difficult to show them that seeking treatment is a good option, although it may seem more viable if their disorder begins to interfere with their life. Treatment for OCD can include therapy in the form of CBT, cognitive behavioral therapy, as well as medication like prescribed SSRIs to help a person reduce their fixation on rules and order. SSRIs increase serotonin levels in the brain and can have a positive influence on mood, emotions, and sleep. Another form of treatment is relaxation exercises. Mindfulness practices such as meditation, deep breathing, and relaxation techniques can help a person reduce their stress levels that are causing them to engage in OCD-like behaviors. There are quite a few stigma and stereotypes associated with OCD. Most commonly used is a stereotype that OCD just causes a person to want to clean and be organized. This is not the case. OCD is a much more complex disorder that can have a drastic effect on daily life. There are many ways to help a person with OCD. Encouraging conversation to learn the effects the disorder has on the individual, encouraging treatment and discussion without stigma, acknowledging improvements, being patient and non-judgmental, and being motivational during difficult times are all behaviors that you can show in order to help. Before we end today's video, remember that personality disorders are much more complex than what we often think based on societal stigma and stereotypes. With access to treatment and support, individuals with cluster C conditions can manage their lives and improve their relationships. Avoidance, dependence, and OCD disorders are things that many people live with, so as individuals, it is important to educate ourselves and combat misinformation.